This is Barnestorm training for the task of entering a new medication. To get started, let's make sure that you've selected a patient, and if you look at the top of the screen, you can see the patient that has been selected, and this is a good way to indicate that you have the correct patient. You may enter a new medication from the patient history screen by clicking on the patient histories button, then the med history button. Or you can enter in a new medication from a visit note on the review med screen. Both of these options will bring you up to this screen here. When the window opens, you will see an active list of medications from the selected patient. To view a history of medications, you simply click on the medication from the list, and the previous entries will show up on the right. From here, click on the Add Medicine button. This will bring you up to the Add Edit Medicine screen. At the top of the screen, there is a blank highlighted with yellow. In this area, you can start typing the medication name. This will bring up a list of medications with those letters in the name. You may either keep typing to narrow the list down, or you may click on the medication in the list. Once the medication is selected, you can indicate the effective date. By default, this will appear as today's date. You will need to change the date to make sure that it matches the date on the prescription bottle. You can do this by clicking the arrow beside the date and selecting the date by clicking it. Beside the date, you can click N if the medication is new and you would like to indicate that, or C if the medication is being changed and you'd like to indicate that. These items are optional. Next, check that the doctor indicated matches the doctor who prescribed the medication. If the doctor does not match, clear the doctor's name and type in the first 3 letters of the last name of the doctor, and a list of doctors will appear, and you can just select the right doctor from the list. You have 2 options when entering medication dose, frequency, and route. The first option is the Med Builder, which is shown here. The Med Builder offers a quick and easy way to indicate dose frequency and route with very little typing. Enter the dose, such as 10. Then click the units for this medication, such as milligrams. Next, enter the frequency by clicking on the frequency, such as QD, and click on when, such as PRN, and click on the route, such as PO. The form of delivery is optional, but this can allow you to specify 2 tablets, for an example. Special instructions are also optional. For an example, you can indicate that the medication should be taken with food, and then you can click on the For box and indicate why the patient is taking the medication, and we could put in for pain. You can also add any other notes about this medication here. Once you've completed the Med Builder form, click the Build Dose Frequency Route button on the lower right corner. This button translates your selections into text, which makes entering these items much faster. Keep in mind that you can toggle back and forth between the Med Builder and the text simply by clicking the box beside Show and Hide Med Builder. So if you need to add additional details that are not available on the Med Builder, you may simply type them in the text area here. Other options on the screen include the treatment indicator, where you can specify what the medication is treating. You can also indicate the schedule for when the patient is supposed to take this medication. To do this, simply click on the button that describes when the patient should take the medication: breakfast, lunch, dinner, bedtime, or PRN. If you indicate the schedule, this information will carry over to the pill box indicator on the Review Med screen in your visit note. However, the schedule indicator is optional. The only required items on the screen are the medication name, the prescribing doctor, and the dose and frequency and route. Once those items are indicated, you can click the Save and Exit button in the upper right corner. If you are entering more than one new medication at a time, you can click the Save and Add Another button instead. This will clear the screen and allow you to add another new medication. This is handy for quick entries of new medications for start of care patients. I am just entering one medication now, so I will click the Save and Exit button. And now you can see that my new medication is on this list with the information here. For additional instructions on adding medication, click on the Help button on your main menu near the bottom and click on Patient Page. This will give you a list of articles with how-to instructions for medications. Click the article you want to see instructions, right-click and select Back, and this will bring you back to the main list. If you don't see the article you want, click Find More Answers here, located at the bottom, and you'll see more articles on this topic. If you click an article here on our knowledge base site, you have some options. Scroll down a little bit. On the right hand of the screen, you can email the article, print the article, you can bookmark the article, and export as a PDF, which will save on your computer. And this concludes our training on adding a new medication.